The following program is broadcast in the public interest by KXLI St. Cloud. The views expressed are not necessarily those of KXLI's owners or management. No rebroadcast or other use of the following is permitted without the express written consent of KXLI.
Good morning and welcome to the Tri-County Journal. This week we're discussing AIDS, and joining us for this discussion, Dr. Rosalind Yomtovian, a pathologist at St. Cloud Hospital, also medical director of the hospital's blood bank. Dr. Yomtovian, thank you for coming in.
Thank you for inviting me.
The pathologists have been taken out of the basement of the hospital and brought out into the public light in the view of AIDS. First question we have to ask, what is AIDS? What is the acquired immune deficiency syndrome?
AIDS is a disease that disrupts a person's immunity. It is caused by a virus, a specific virus. It is transmitted predominantly sexually, so you can consider AIDS to be a venereal disease. It can also be transmitted by blood products, and sharing of needles.
How did it get to the United States? I understand it didn't start here.
It is believed to have come to the United States from Africa, Central Africa, brought to Haiti because of exchange of workers between Africa and Haiti in the 1970s, and ultimately picked up and brought to the United States predominantly by gay men who were vacationing in Haiti, and then returned the disease to primarily the coasts. And then, since the late 70s, it has spread throughout the United States.
This is a new disease, something which we didn't know about before?
It's believed in humans to be a new disease, and I say in humans because it is not clear whether this virus has been around for a fairly long time in animals. There are some people that believe a specific species of monkey has carried this virus for many years, but it only recently came from the monkey to the human. So yes, it is a new disease in humans.
Now, transmission of the disease, you mentioned earlier from the gay population, that's changing, isn't it? How is the disease transmitted?
Yes, it is changing. I should say that there's evidence that a prostitute in the United States was carrying this virus before the knowledge of this disease existed. This disease was not called AIDS until 1981. And there's evidence for the virus in a prostitute back in the mid-1970s. So I want to emphasize that there's nothing unique to gays so much that they were the ones who initially spread this disease. It was more or less an accident that it came into the gay population in this country. In Africa, this disease is equal in men and women. In this disease, it is obviously predominant in men because it's predominant in gay men at this point. Basically, it spreads sexually, so promiscuous sexual activities in the early going will spread this disease rapidly. And since there is a segment of the male gay population that is highly promiscuous, this is why it rapidly spread among the gays. Now, as time goes on, the disease will spread out of the very promiscuous groups. As soon as the number of people carrying the disease increases, the number of contacts an otherwise normal person would have to have with someone else becomes increasingly smaller as the number of carriers for this disease increases. And that is currently what is occurring. The disease is spreading from the gay men through mainly bisexual activity, some drug use, into the heterosexual population, and also through blood products, of course, predominantly the hemophiliacs. The disease is currently spreading in the heterosexual population.
So let's talk about the other ways you can get AIDS beyond sexual activity. You talked about hemophiliacs.
Correct. I want to emphasize that AIDS is primarily a venereal disease. This accounts for probably at least 70% of cases. The second important way is drug addicts that use needles, that share needles. I won't make a value judgment on drug addiction. If someone is a drug addict but takes a new needle each time, they will not get AIDS. So it's not the habit per se, it's the sharing of needles, and that group is about 17%, quite large. After that, you have much smaller numbers. In the early days, there were many Haitians involved. That number is now declining. They are not considered at particularly special risk for this disease anymore. So hemophiliacs would be your largest group of blood product users. Most hemophiliacs, 80 to 90%, have been infected by this virus. The reason is they use blood products that are pooled from as many as 20,000 donors. Now, if only one of the donors was a person who was carrying the AIDS virus, I'll call it the AIDS virus, even though that's not the technical name for it, but I think people will know what I mean. You could see that if one lot of this clotting substance is contaminated that many, many different people are using, you could see how this whole population can be quickly contaminated. So those three groups are really the majority of cases.
What about these frightening stories we've heard about saliva or tears carrying the virus from person to person?
So I think you have to make a distinction between what carries the virus and what is infectious. And I think this is what people, don't distinguish between. It certainly has been isolated in tears, and it has been isolated in saliva. But whether these are infectious, transmissible substances is either zero, no, completely, or so rare that to focus in on them is to take away from what's really critical in terms of transmission, and that is sexual relations, intercourse, and sharing of needles.
How long does it take for this disease to develop?
The disease has a very interesting clinical pattern. Once you're infected with the virus, there are now a couple of studies that demonstrate you experience an acute illness similar to infectious mononucleosis. You get symptoms of fatigue, malaise, you just don't feel good, feel washed out, maybe you get a fever. Some of the lymph glands enlarge.
This is very quickly after infection?
Yes, this is about 2 weeks to a month, maybe a little sooner. That goes away, and following that, the person will feel completely well for an indefinite period of time, from a year to 2 years to 3 years to as long as perhaps 6 or 7 years. However, in this interval, they will be carrying the virus and are presumed to be infectious to other people. That's what is so frightening about this disease, that a perfectly healthy looking and feeling person can give this disease to another person. That is why the wives of hemophiliacs, some of them have acquired this disease, and why a mother who has acquired it from a husband who's a hemophiliac can transmit it to a baby. And this is what is happening now with this disease. It is why it is so frightening, because it is spreading in this manner to the regular, ordinary people.
Let's take a break, and when we come back, talk a little bit about what's called pre-AIDS, which you tell me is not used anymore. We'll be back to define that term right after these messages. Pathologist and medical director of St. Cloud Hospital's blood bank, Dr. Rosalind Yomtovian, is here talking with us about AIDS, acquired immune deficiency syndrome. You told me before we got started today, pre-AIDS is a term no longer used?
Yes, because pre-AIDS implies that everyone with it will get AIDS, and that clearly is not known. I like to make an analogy between what they call pre-AIDS and someone who has angina, who has chest pains that are related to hardening of the arteries of the heart. Not everyone with angina will get a heart attack. It certainly is a risk factor. If you have angina, it's increasingly likely that you will suffer a heart attack, but it's by no means certain or guaranteed. And hence, with what used to be called pre-AIDS, if you have a certain milder form of illness related to infection with the virus that causes AIDS, you're certainly at a higher risk of ultimately developing AIDS. But how many of these people will go on to develop AIDS is not clear.
Do you see the problem increasing or decreasing now?
Oh, it's absolutely increasing. It's critical now to me. There are various estimates of the number of carriers of this virus to range between 1 and 2 million. I guess I believe it's probably closer to 2 million, and spreading, because people are spreading this disease that don't know they have it. And
how do you find out if you're a carrier or if you have the disease?
okay, currently there is a test available that is a marker for the virus. It's not a specific test for the virus. It's a test for an antibody related to the virus. The test is not perfect. This is a problem with it. There will be some people that have a positive test that don't have the virus. There will be some people that have a negative test that have the virus. So hopefully these numbers are small, but this is not resolved yet. But let us say that the majority of people will have a positive test, have the virus, and therefore they're infectious. They are testing blood now. They are offering this test to people in high-risk groups at alternate test sites. They currently have 2 of these that I'm aware of in Minneapolis and St. Paul, the Red Door Clinic and Room 111. They have a backlog of about 2 months. In other words, it takes 2 months to get an appointment at these places, so clearly...
Is it an involved test? Is that why it takes so long?
The test is simple, extremely simple, and even cheap. And it's inexpensive. It takes long because of the implications related to getting a positive test result. There's a lot of counseling involved in it. But the test is available. In the state of Minnesota, there are several labs that do run the test. We currently at the hospital send our tests to be done at the Red Cross in St. Paul. The reason we do that is not that we're not equipped to do that at the hospital. We feel that it would enhance confidentiality if we directed physicians in their offices instead of sending the tests to us, and therefore we would know who the person is that would have a positive result, to just send it directly to the test site. The less people that know about this, I think the less chance there will be for problems with personal freedom and infringements on civil liberties related to these test results. This is a whole other issue that is related to the medical disease AIDS.
Let's talk for a minute about some of the social problems here. We've heard stories about youngsters not being admitted to school, other youngsters admitted to school, depending on which state those youngsters reside in. I know you have young children. Is it safe to send your children to school with an AIDS victim?
I would send my children to school with an AIDS victim. I will not tell you that there's absolutely no chance that a child will not get AIDS from another child at school. I think would that happen, it would be limited to the ways we know it's transmitted, sexually and through blood. So what I'm saying is if a boy who carried the AIDS virus was hyperactive sexually and engaging in activities that were not proper for that particular person, yes, there would be a chance. But sitting next to someone, no. Spitting, probably no. I would just say no. Saliva may have the virus, but it appears to be non-infectious for the disease. So I would not be afraid to send my children. I would certainly educate them to make sure that if they see someone engaging in activities that were high risk, such as spreading seminal fluid around